I'm joined now by Show Me Institute's Brenda Talent. Brenda, good to talk to you again. It's been a while. Thanks for being on the show.
Thanks for having me.
Okay, so we don't have time to get through everything on here. This is pretty extensive, so I encourage people to go to showmeinstitute.org, and the first thing you're going to see is a link to the blueprint. Let's start with education. There's a number of things with education. No secret, Show Me Institute has been leading on school choice for a long time. One of the things that you've added in the conversation over education freedom has to do with Parents' Bill of Rights. That touches a lot of areas. What's the focus that you think lawmakers should keep in mind when dealing with a push for, parental rights in education?
Well, it's all about transparency, Mike. I mean, if you're sending your child to a public school, which is funded by taxpayer dollars, we just believe it's fundamental that taxpayers have a right to know what's being taught, how the money is being spent, and we also need to know how the kids are performing. So it's about transparency in three areas. It's about the curriculum, it's about performance, and it's about finances. Because how can parents make decisions without those kind of basic information? And of course, we, through mostschoolrankings.org, that's our website, we provide transparency on performance. We show you how they're doing and teaching kids on reading, math, how they're competing with other schools, school districts. Through our Sunshine request, though, we tried to get the curriculum, and it was amazing how many school districts stonewalled us on that or wanted to charge us outrageous sums of money in order to reveal that kind of information. Seems like a pretty basic right for parents and taxpayers.
Good morning, Brenda. Gabe Pfeiffer here. One of the other things I think that flies under the radar, but you guys address it in your blueprint here, is occupational licensing. And I think there are a lot of people out there who don't really know what the problem is, but it is very much an impediment to economic freedom in the state.
It truly is. I mean, we've made progress in the state. A few years ago, we passed a law which supposed to recognize universal licensing. In other words, if you were licensed in another state, you came to our state, we weren't going to make you go through the expense and the process of getting relicensed. But we've sort of chipped away at that. There are, not to get too much in the weeds, but there are legal agreements where basically we're agreeing with other states to basically reinstitute some of the, if you will, the gatekeeping that happens in a number of occupations. And the thing is when we look at occupational licensing in the state, you would think, okay, if you want to protect someone's health, or individuals' welfare, that makes sense. But as we point out on occupational licensing, to be certified as an emergency medical technician, well, you need 26 certification days. But to be certified as a makeup artist, you need 175 days. A lot of these certifications just don't make any sense.
Yeah, and they're an impediment to a free market, an impediment to entrepreneurialism, which is why, as you mentioned, I mean, this is getting into the weeds a little bit. But once people understand the basic concept, you get that light bulb that goes on that says, oh, yeah, wait a minute. Why are these rules arbitrarily trying to keep some people out of the market?
And impose costs, which, individuals who are trying to earn a living, they may just be starting out. They don't have the funds available to invest in some of the unnecessary education that our state is imposing in order for them to practice their chosen profession.
Okay, showmeinstitute.org is where you're going to find the 2024 blueprint. And like I said, we're not going to be able to go through all of these. We're visiting with CEO Brenda Talent right now. We know that you all are you're not all about big taxes and high taxes. You are a voice of reason on that. But let's look at some of the other things that are in this. For instance, when you talk about income and property tax reform, we've had a few of our elected officials try to bring up particularly property tax reform. What should lawmakers consider doing when it comes to income and property tax reform? Because that drives so much of the economy in ways that government, frankly, shouldn't have that much control.
Well, I would say we give people a range of things. So a simple one is when you're talking about personal property taxes, have rollbacks. We don't have rollbacks, and we all saw what that happened when we had to pay taxes on our our cars. Better yet, let's just eliminate that particular tax. The other thing is really to look at a land tax, because, and this is the other end, if you really want to reform this, let's change how we're taxing property generally in this state in a way that makes more sense. But there are a number of items here where we've seen our tax bills go up. When inflation goes up and the assessments go up, I think a number of us have been startled by our property tax bill. So there's what I would call tweaks for property tax, and there's major reform that we're putting out there as we look at this whole system of taxation.
Yeah, and I'm still mad that I have to pay taxes on something I've already purchased in order just to keep it, but that's an argument for a different day.
Yeah.
So following up on that, Brenda, Taxpayer Bill of Rights, what does that look like in an ideal world in Missouri?
Well, many people don't know this. We have something called the Hancock Amendment, which people who do know about that think, oh, that protects us from tax increases unless we voted for them. Well, Hancock is no longer providing the protections that it used to, or that people think it does. And so we're really looking at, and our government budget, by the way, has grown tremendously. From 2019, it was $36 billion. Now it's over $51 billion. So clearly our Constitution right now is not protecting taxpayers from a huge expansion of government. And what we're proposing is a way in which we can give real teeth to what Hancock intended to do, and we're doing it through a Taxpayer Bill of Rights.
Brenda, I know we've kind of been preoccupied in the news cycles, over and over again with other things, but healthcare reform is still a major issue. What does the Show Me Institute have to say about healthcare reform in Missouri?
Well, again, there's some simple things and there's some big things. Simple things is just price transparency. Let's allow the consumer to have information to make decisions about where they're going to get their health care. So if you need a knee replacement, you ought to be able to check what the cost is. So that's pretty simple, and the federal law actually requires it, but it has no teeth in it. State can begin putting teeth into the requirement of price transparency. Then aside from that is really what we call free market healthcare reform. There are things the state can do, like repealing certificate of need. This is, again, sort of another barrier to entry for companies where you basically have to have your competitors approve of you building a facility to provide certain healthcare services. The other is more major. We've got to really reform how we're accounting for things like Medicaid. And then the other is to try to get waivers from the federal government so we can actually institute major reform in how we provide Medicaid. And then the final thing, we saw this during COVID, where a number of limitations on what we call scope of practice, like getting a nurse to provide you services, or telemedicine, were lifted. Once the COVID emergency passed, all those restrictions were reinstated. And they worked. I mean, they really helped people have access to health care. And so we're saying, look, just go back to what happened during COVID. Lift these restrictions so people, through telemedicine, through using a nurse practitioner, can get the health care that they need. So expanding those services and the availability of health care.
Okay, Brenda, we just have a minute or so left here, but let me back up a little bit, just kind of a more of a conceptual idea. When you talk about free market healthcare reform, there are so many people who absolutely, the idea of a free market healthcare anything just seems foreign now, since the Obamacare debates of all these years ago. Can a free market provide a better, less expensive, more efficient healthcare system? Because we've got a couple of generations now, Brenda, who have just been taught if government doesn't run it, it's not going to be available and you won't get it.
Mike, you and I know that the market works.
Yep.
And if you lift the restrictions, if you let people compete, if you let people be entrepreneurial in this area, you will see cost reductions. But here's an important concept. What we've done with our whole healthcare system is we've separated the patient from the doctor. We need to restore that relationship so that the doctor and the patient can make decisions, and then you'll get, the market will begin operating, and you'll see a reduction in healthcare. Part of our problem now is, I got an insurance company. I'm not making these decisions based upon my discussions with my physicians. I'm like, oh, my healthcare will cover it. I'll just go do it, even if I don't really need it. Whereas, if the market were working, I'm like, let me see whether this is really needed or not.
All right, showmeinstitute.org, and you're going to find the 2024 blueprint right there at the top of the page. CEO Brenda Talent is with us right now. Brenda, great talking to you again. Thanks so much for the update on this. Good job as always on the document.
Thanks, Brenda.